Hello everyone! Today we will be discussing the role of clotting factor VII in thrombotic events, specifically its association with myocardial infarction and deep vein thrombosis. Factor VII is a crucial component of the coagulation cascade, but alterations in its levels can lead to significant clinical outcomes, including increased risks of heart attacks and blood clots. We will explore the molecular mechanisms behind factor VII, its clinical significance, and potential management strategies. To understand the role of factor VII, let's briefly review the coagulation cascade. Blood coagulation is a complex process where a series of enzymes activate one another to form a clot. Factor VII, also called proconvertin, is one of the key players in the extrinsic pathway of coagulation. When vascular injury occurs, tissue factor expressed by endothelial cells binds with factor VII. This complex activates factor VII to factor VIIa, which then activates factor X. Activated factor X converts prothrombin to thrombin, which leads to the formation of fibrin and the stabilization of the clot. Factor VII is a serine protease that directly influences the initiation of thrombin generation. Its activity, therefore, has a significant impact on the overall coagulation process. Normally, factor VII levels are tightly regulated to ensure a balance between coagulation and bleeding. However, elevated factor VII levels are associated with hypercoagulability, a state where the blood is more prone to clotting. This can increase the risk of venous thromboembolism, including deep vein thrombosis and arterial thrombosis, which can lead to conditions like myocardial infarction. Elevated factor VII levels are often observed in individuals with cardiovascular risk factors, such as hypertension, hyperlipidemia, and smoking. Genetic polymorphisms in the F7 gene, which codes for factor VII, may lead to an increased baseline level of factor VII or a heightened response to other prothrombotic stimuli. One such genetic variant is the factor VII-5' promoter polymorphism, which can increase factor VII expression. Elevated factor VII promotes clot formation, contributing to atherosclerotic plaque rupture in the coronary arteries, which can lead to myocardial infarction. Now, let's discuss the link between factor VII and myocardial infarction. Atherosclerotic plaque rupture is one of the primary causes of myocardial infarction. When a plaque ruptures, the underlying tissue factor is exposed to the bloodstream, triggering the coagulation cascade. High factor VII levels enhance this process by promoting thrombin generation and fibrin clot formation at the site of plaque rupture. The thrombus can occlude the coronary artery, leading to myocardial ischemia and eventually infarction. Clinical studies have shown that patients with elevated levels of factor VII are at higher risk of acute coronary syndromes, such as myocardial infarction. Elevated factor VII can act synergistically with other prothrombotic conditions, such as hyperlipidemia, hypertension, and diabetes, to increase the risk of cardiovascular events. Moving on to deep vein thrombosis, or DVT, this condition is characterized by the formation of blood clots in the deep veins, commonly in the legs. DVT can lead to severe complications such as pulmonary embolism when the clot dislodges and travels to the lungs. Elevated factor VII is implicated in venous thrombosis due to its role in promoting coagulation and clot formation. The mechanism by which elevated factor VII leads to DVT is largely related to its prothrombotic properties. High levels of factor VII increase thrombin generation, which can overwhelm the fibrinolytic system and lead to the persistence of clots in the venous system. In patients with DVT, elevated factor VII levels are often found, especially in those with other underlying risk factors such as immobility, recent surgery, or genetic clotting disorders. Some individuals have genetic mutations that predispose them to higher levels of factor VII, contributing to their thrombotic risk. Factor VII gene mutations can either increase the synthesis of factor VII or affect its functionality. One common mutation is the factor VII-5' promoter polymorphism, which increases the transcription of the F7 gene, leading to elevated factor VII levels. This mutation, along with other genetic prothrombotic mutations, such as those in the prothrombin gene or factor V Leiden, can significantly increase the risk of thrombosis. So, how do we diagnose and manage elevated Factor VII levels and the associated thrombotic risk? Diagnosis. Elevated Factor VII levels can be detected via blood tests. If a patient has a history of thrombosis or cardiovascular disease, measuring Factor VII activity can help assess their thrombotic risk. Genetic testing can also identify mutations in the F7 gene that predispose individuals to higher levels of Factor VII. Management anticoagulation therapy is commonly used to manage patients with elevated Factor VII who have a history of thrombosis. Medications like warfarin or direct oral anticoagulants can help prevent further clot formation. Lifestyle modifications are crucial, especially for patients with cardiovascular risk factors such as obesity, smoking, and hypertension. A healthy diet, regular physical activity, and smoking cessation are key components of management. For patients with Factor VII deficiencies, the treatment focuses on replacing the clotting factor in case of bleeding episodes, but for those with elevated levels, the goal is to reduce clotting risk. In summary, Factor VII plays a pivotal role in the coagulation cascade, and its elevated levels can significantly increase the risk of thrombotic events like myocardial infarction and deep vein thrombosis. Understanding the molecular mechanisms behind its activity and the genetic variations that lead to higher Factor VII levels is crucial in diagnosing and managing these conditions. By focusing on both genetic and environmental risk factors, we can better manage patients with elevated Factor VII and reduce the incidence of thrombotic events. Thank you for your attention.